Vulvovaginal candidiasis or vaginal yeast infection is a condition that affects millions of women around the world. The symptoms are felt in the vaginal area and include irritation, itching, pain during urination and sexual intercourse, and vaginal discharge, which is thick or watery in consistency. There are many treatments available to women and girls who suffer from yeast infection. Aside from medication, home remedies are recommended as well for those who want to try out a more traditional approach first before taking pills or topical applications. One of the most highly recommended remedies for yeast infection is vaginal douching. Many women report relief of symptoms of yeast infection with regular douching. Let us take a closer look at the pros and cons of this remedy. The basics of vaginal douching. A liquid solution is used in douching, which is a procedure that has been employed for centuries to cleanse the vagina. Vaginal douches may be purchased in pharmacies and health supply outlets. These preparations come in different pregnancies. Usually, the list of ingredients includes antiseptics. When done at home, a traditional mixture of water and vinegar is used to wash the area. It is a practice that is promoted for personal hygiene, but also for the prevention of infection. The procedure involves forcing a liquid solution, or in some instances clean water, into the vaginal cavity. The purpose is to remove vaginal discharge. The applications of vaginal douching include cleansing of the female reproductive area after sexual intercourse to prevent pregnancy or during the menstrual cycle. This procedure is particularly effective in removing the blood that remains in the canal after a menstrual period. The benefit of douching in the relief and treatment of yeast infection remains a controversial topic. Women who douche regularly report that they feel more fresh and cleaner because of the practice. According to those who favor the practice, one of the biggest benefits of douching is the removal of implicit. Is douching a harmful procedure? Some studies on women's health reveal that douching amongst adolescent girls and adult women may lead to ectopic pregnancy. There is also evidence that pelvic inflammatory disease is associated with the practice of vaginal douching. Pelvic inflammatory disease is a chronic illness that may be fatal. In some cases, it may also lead to infertility. Based on a report released by the American Journal of Public Health, vaginal douching is not a safe procedure because it results in an imbalance in the vaginal canal, which increases the risk for infection. This occurs because the delicate pH balance in the vagina is easily altered when foreign substances are introduced. Health practitioners are recommending instead that women lead healthier lifestyles and allow the vagina to cleanse itself. Once balance is restored, yeast infections are usually resolved without direct cleansing methods. Moreover, the flushing procedure might also introduce foreign matter or bacteria into the vagina. If the harmful microorganism spreads to the rest of the reproductive tract, the cervix and fallopian tubes may be infected as well. Women who plan to use vaginal douching preparations must consider all these factors and then decide whether the risks are worth the promised results.